Hello everyone. So today I'm going to talk about colleague scenarios. You might be very well aware of these scenarios because they are quite common in Lab 2 and they are very frequently tested. So the core of these scenarios is to observe your communication skill while talking to your colleagues. And the rest of the 15 stations, they observe you while talking to your patients. In this scenario, you have to talk to your colleague. So your colleague may be a similar grade doctor, he may be a junior doctor, or he may be a student, either a nursing student or a medical student. Okay. So the whole of this communication is about an ethical concern. So there might be an ethical concern about this colleague that you might have noticed, or somebody else might have brought it in your under your notice, and now you have to talk to your colleague about this, and you have to make sure that your colleague understand the impact of this, and together you come with an action plan and execute that action plan. Okay. Also, it's very important to remember in these scenarios that you are talking to a colleague. Okay, so you are not in a position of authority, right? So please, in these scenarios, do not start interrogating your colleague like like an authority figure, like a policeman, and also do not become overly frank as if they are your best friends or your siblings. Okay, but instead take a middle path and in a non-judgmental way collect data from your colleague and then explain the impact to your colleague and together come with an action plan. All right, so there is a general approach to these stations. I will first discuss the general approach and how you are going to tackle this type of a scenario, and then we are going to discuss each scenario in detail. Okay, so let's have a look at the general approach first. All right, so there are certain steps to the general approach of these stations, which I will discuss, which I'll first discuss, and then we'll go on to discuss each separate scenario. All right, so the first step is introduction. So you already know that in each Prep 2 station, when you enter the station, you need to introduce yourself. Everyone has their own style of introduction. I used to introduce myself like, hello, I'm Dr. Daisha. I'm one of the doctors in the department today. And can I get from your name and age, please? This was usually my the usual way of introduction. But to your colleague, you are not going to introduce yourself like that. You will just use your first name. Hello, I'm XYZ. I'm one of the FY2, and you must be Simon. Okay, whatever the name they have given to you. All right, so you will introduce yourself like this. All right, then you will inquire. Okay, first of all, after your introduction, when you introduce yourself to your colleague, you need to do a small talk. Okay, you need to ask, so okay, so how are you doing? How is the rotation going? All right, but do not go into detail, just one or two questions. How are you doing? How is the rotation going? How is everything? All right, after this, you um inquired about the ethical concern that is brought that has been brought into your notice. Okay, so for example, if it has been brought into your notice that your colleague has been, for example, if the nurse is suspecting that he has been using some drug, so you will need to inquire about that. For example, if the nurses have told you that they are suspecting that your colleague might be using cocaine, so you will say that so do you have any idea why we have arranged this meeting today? Okay, so we have noticed that you might be using some drugs or some cocaine. Okay. If he does not, if he denies, because initially the colleagues usually deny, he might accept right from the beginning, but in most of the cases they usually deny. Okay. So after this, if he denies, you offer confidentiality. You tell him that whatever we discuss will remain confidential. Okay. Remember this line. Whatever we discuss will remain confidential. Do not say it will remain confidential between me and my team and stuff like that. Just say it will remain confidential. Okay. After that, you need to know about the impact of the problem. For example, if this is your colleague who has been coming to work under the influence of alcohol or under the influence of cocaine, then you need to know what impact has it made over the patients. You need to know whether he has seen any patient today, okay, and whether or not he understand the impact of his problem. Okay, the next step is the history. So you need to take, if the your colleague agree, usually after offering confidentiality they agree. So if he agrees that yes, I'm using this drug, or so after that you like ask a detailed history. Okay, so history taking part is just like a patient. So if your colleague is using cocaine or he's using alcohol, so you need to ask him some questions like, since when have you been using? Are you using regularly? Okay, is there any reason that has been pushing you towards using these drugs? All right. Then you have to formulate an action plan. Okay, so for example, he's a student, you need to tell him to go and tell your educational supervisor. Okay, if he's a doctor, then you need to inform the ward consultant, all right, and the educational supervisor as well. And then you need to recheck all the patient that he has examined or he has interacted with. And then there is a catch-up part. So you tell that your colleague that after 2 weeks or 3 weeks, I will catch up with you and we will discuss it and we will see how you have progressed further. Okay. So I will explain all these steps further in each separate case. And hopefully then you will be able to understand it in a more better, understand it and perform it in a more better position.